Welcome to next segment of VICHARDHAN. My name is Aarti Takavne and it is a pleasure to introduce Dr. Sunirmal Sarkar. Dr. Sunirmal Sarkar is a man who would want you to make and believe in homeopathy more. He is one of the busiest homeopathy practitioners in India and sees almost 100 patients every day. Dr. Sarkar received WHO fellowship in 1998 and he has never looked back. Right now he is also researching in cancer. Every day he sees around 25 cancer patients and his research and knowledge in cancer is commendable. He is associated with Bal Kalyan Sanstha since 2023, where we have seen amazing results with the children with neurodivergent disabilities. Welcome, Dr. Sarkar. It is an honor to interact with you. First of all, I would like to congratulate you in treating 200 plus children with very difficult disabilities at Bal Kalyan Sanstha. And yesterday I heard that you added 50 more patients, which is commendable. We started this camp in Bal Kalyan Sanstha with a specific mission in 2023, to be very specific, 1st January 2023. I would like to know what was the mission, what was the vision when you started this specific clinic at the Sanstha?
Just one thing, just narrating or answering your question. In homeopathy, this backward children treatment, it is nothing new. Our masters have treated this backward mentally and physically, both way, the children successfully if we go through our old books. Purana kitab mein bahut sare hai. And this, but at the present moment, this disease or this problem, I am telling not disease, problem, it is now increasing day by day. So many causes are there, and I have seen some beautiful result by our teachers for this disabled, mentally retarded children when I was a student. And accidentally or incidentally, I come to the relationship with Bal Kalyan, and that time I thought it's a good idea that really in which way we can minimize the suffering of them and simultaneously minimizing the anxiety and burden of the parents. And from that vision, I am attached with Bal Kalyan Sanstha, and I am really, I think it is my honor, or I am blessed that I am really handling this group of children, and they are really getting good results through homeopathy. So vision, minimize the suffering and do something for the society as a homeopathy doctor.
Okay, what a commendable thought that is. Now, when you started before we started the workshop, I'm sure a lot of research must have gone in it. So what was the direction of your research, especially when it comes to treating the children?
Actually, direction, I am not criticizing other pathies, but as you also know, the diversity of symptoms. बहुत सारे स्पेक्ट्रम है ये डिजीज के लिए. Not one disease or one symptom, it is not possible. Children, we are telling that they are special children, or the autistic children, ADHD children, cerebral palsy patient, but their symptoms are so versatile. But especially the modern medicine, they are trying to find out single medicine by the name of nomenclature, that this medicine for this disease. I think it is not possible, impossible I am telling, yes, but anyhow they can minimize their hyperactivity by generalized medicine. But really, if you are willing to improve or minimize the drug dependency, then individualistic approach is the best way. And homeopathy is still thinking that every patient is different and every patient needs separate medicine. And this is a slogan of the WHO also this time: treat the patient, not the disease. Because patient, when we are thinking patient, as you are also from psychiatrist group, think that patient's psychology and body, we are dividing it, but we cannot separate it.
Exactly.
We cannot separate it.
True, true.
And another thing, that whatever the neuropathological complex we are bringing in this type of patient, but test tube treatment with some tablet or injection or whatever the chemical, we can show that it is neutralizing this neurotransmission or the results. But we should think of that human nature or that the living children, they are not the test tube. They are easily influenced or reflects with the environment, relationship with parents, relationship with the diet, relationship with the past diseases. So these type of factors, when it is coming to the conclusion, then every child is showing different reaction. And that we are collecting and we are trying to minimize that group of symptoms. And that is the beauty of homeopathy, that every child needs separate medicine according to its own demand or utility or neurological complex, because reaction differs. We may not change the environment,
right,
but reaction can be changed according to our own immunity, our thought process,
right,
our diet, and the influence, social influence, educational influence, and homeopathy also try to cope with that situation. That is the beauty of homeopathy.
Yeah. I think that's a beautiful way of looking at it. Every treatment, every therapy should remember this, that treat the child, treat the individual and not the disease. I completely agree with you, even from a psychological perspective. Now, the children, like you said, they have versatile symptoms, they have versatile needs. So how do you try and achieve those needs in the children with intellectual and neurodivergent disabilities?
Even also neurodivergent disability, one of the things, that disability, but that is also from our learning point, learning point of view, if we analyze these cases, that disability also, it is segregated and different from every person, every child to child. We are telling disability. But here the beauty, I am telling that homeopathy, it takes in such a diversion that disability, whether it is the mental disability, physical disability, whether it is the motor neurology, sensory disability, not only that, peculiarity of the homeopathy, and even they are taking into account the side, whether left side is involved, right side is involved, lower limbs are involved, upper limbs are involved, and another thing, the reaction to the weather, atmosphere. That is also the only in homeopathy system, most probably they are taking, the child is really react with sun, new moon, full moon, darkness, light, when he is alone, when he is in company. So every time we are taking into account this as a whole. सब एक साथ मिलकर child in which way he is reacting. That is the beauty. Some child, even in disabled condition, I think yesterday also we have seen that they cannot tolerate light.
Yes.
And some other groups they are telling, even disabled, but they are crying as soon as you are put off the light. And as soon as you are putting on the light, light is there, they are not disability I am telling, at it mentally they become cheerful. They are getting afraid, their fear or the psychological, neurological reaction, it is changing to a different polarity. So this light reaction, then relationship with the parents, individual reaction, desire company, aversion to company, these are the beautiful approach of the homeopathy, that whenever we are selecting the medicine, that subconscious mind or the traumatic event, but it physical reaction, it differs person to person, and you have to collect that.
Right.
You have to collect that.
Right.
Not only that, even you are telling physical disability, but in which way? Suppose this deglutition. Some children may be hysterical, but unable to take the liquid, but they can taking the solid food very nicely.
Yeah.
But it should be totally opposite. Or sometimes that deglutition, when empty deglutition, they are crying. You have to judge very honestly and very methodically and systematically. You have to be very much punctual with the behavior or I am again tell the reaction of the child, because most of the children, they cannot speak.
Right.
Okay, so you have to make a picture in such a way from your knowledge of the materia medica and from the behavior of the children, analyze it, then you have to put into account that which medicine at the present moment suitable. That is the art part or the deeper knowledge I am telling. It is not the knowledge, but after exercising knowledge from books, we have to get some sorts of wisdom.
Exactly.
And that wisdom will help you how to differentiate children from person to person.
Yeah.
And another thing, that children, even if they are disabled, but even the physical constitution, we are taking very much into account. Fatty, flabby, chubby, kitna mota hai, kitna lean, thin, okay?
Yeah.
And that is, and this is also most important for homeopathy. Then thermal reaction, that is sweating. If you sweat, so the child is sweating, from our analysis we have observed, the child is sweating only on single
face.
part.
Okay.
Single part. Just one drop is coming here. One drop is the location of the tip of the nose. Or oily face, dry face, rough and tough skin, greasy face. It is too much greasy, oily.
Right.
They are not using, but it is sebaceous secretion is maximum, and that is identifying a group of medicine. And it will help to neutralize this neurohormonal activities by observation, that these give this medicine. Not only that, if you observe, because it is not easy, but by observation you have to think, a child is crying. Somebody, when he is on the lap, he feels better.
Yeah.
Okay? Somebody, the child is going from one mother's to other place, and he is laughing. And another child, when you are taking to your lap, he is pulling your hair, aggressive, abusive. But the difference between in one child, icy cold of the head, and another is hot perspiration. Both the child, they are physically diagnosed as irritable children, but it differs from physical aspect. So this body reaction, it is changing every moment from person to person.
Right, physical, constitutional and even
aspect.
Reaction part, they are different.
Yeah. And for this reason, if we take homeopathy from this point of view, definitely individual reaction can be controlled with individual medicine. We can't do a generalization.
Yeah.
Generalized means this is for autistic child, this is for CP patient, this is for your ADHD child. It is never possible.
Yeah, we cannot generalize in any way.
Yeah.
So homeopathy basically looks at the overall growth perspective of the child, versus there are some therapies who also treat only the symptoms.
Yes, but yes, symptoms minimization does not necessarily mean that is your curing.
Yeah.
It is known as palliating. You just simply remove the symptoms, but until and unless the root cause, why it happens, if we don't postpone this condition, you have to stop from the source.
Yes.
And source, mostly it is mind. And if you think that how mind is acting, you ask the question that how I was influenced. I am taking a small story of Mahabharata.
We would love to hear that.
That yes. Mahabharata, that we know the Freud, father of our modern psychology or whatever it is, psychoanalysis.
Dr. Sigmund Freud.
But if we go through the story of Mahabharata, Yudhishthir, when he was defeated in gambling, then he with his 4 brothers have to go to the forest for 12 years.
Yeah, in the exile they have to go.
12 years. So when he is leaving the Hastinapur, that time so many sages, so many persons are telling advice. Yudhishthir, please do this, don't do this like this way. So one says, one Muni, he came to Yudhishthir and he's asking, I am not blessing you, just I am asking one question, Yudhishthir. And then the says, uska naam tha Shaunak. The Shaunak Rishi, he asked, Yudhishthir, can you tell me, I am asking question, and can you answer it? Like what happened? That if I hit a Ayaspindo means a round ball made of iron. Ayaspindo, if I hit, ultimately what it will happen? What will be the result? Then Yudhishthir answering that it will be red. If you give heat to any iron ball or iron, ultimately it will be red. His next question was, if I put this iron ball in a vessel full of cold water, what will happen? Then he is telling, Yudhishthir answering, okay, ultimately that it will lose its heat, its brightness, but the heat will transmit it through the water, and ultimately heat will heat the vessels. And Shaunak is answering, hey Maharaj, remember this is the relationship between mind and the body. If your mind is irritated and hot, ultimately it will transmit it to your body and it will produce lots of heat and problem. So try to keep your mind cool.
True, very true. Because when we talk about ADHD or hyperactivity, lot of people think the hyperactivity is in the body. They don't understand it is in the mind, and it is mind that drives the body to be hyperactive.
And for this development of the mind, madam, I think this is the only system we are taking the history of the pregnancy. Even in Ayurveda or even in our culture, we try to keep mental peace of the pregnant mother by different occasion or by different social rituals, because it is highly needed.
Right.
Mother's mental position, problems, it always transmits through the umbilical cord to the child.
True.
So irritability, aggressiveness, abusiveness, mental trauma, diet, anxiety, everything is responsible for the development of the child.
Right.
Okay, so we have to keep proper thought process that what was the situation of mother during pregnancy. Is it a sudden pregnancy, planned pregnancy, it was unwanted pregnancy, even unwanted pregnancy, but accidentally it happens. Children's mental makeup automatically it is not cope with the situation.
Right.
Yeah, it cannot be normalized. And not only that, what we are observing in our places also, especially in our Indian culture, honestly, the daughters are not accepted too much. Most of us, we are rather asking for male child. And subsequent 2, 3, 4 daughter, the last daughter, he become mentally dwarfed, not accepted by the parents, not accepted by other society also. And even mothers, they are telling very frequently that anyhow God has given you, but would you have not been, how you have not become a male? And that last girl is listening from years to months together, years together, and ultimately become a mental patient.
Yeah.
And from their child, we are getting lots of mental trouble, not accepted by the society.
Yeah. True. I think this is a very different piece of knowledge, and I'm very sure a lot of us haven't even thought about it. Yeah.
And so
the success lies in the history of the patient.
Yes.
But at the same time, now we come across so many children who are non-communicative, they are non-verbal. So is it challenging to take history from such children, and how do you find a way to that?
Yes, because when it is not, then as I am telling, observing in which a patient is behaving, that is one. Then interpretation, that is the beauty of homeopathy, that when we are taking the case history, that we are asking the parents that why and how. That is the starting point. That is a starting point, or the stimulating or the exciting factor. And parents are mostly telling, yes, it happens after the fall, after some vaccination, after diarrhea, after dysentery. So that exciting factor or stimulating factor, the onset factor is very much stimulating. Because this type of reaction, remote injury, especially in no other science, or it is accepted but they don't know how to find out the remedy, that not well sees this. Parents are telling that measles हो गया, चिकन पॉक्स हो गया, डायरिया हो गया, उसी के बाद मेरा बच्चा क्या हुआ. They are not fully recovered from that particular ailments. That is a good clue that most probably the constitutional defect is there. It should be automatically, it should be recovered. No.
Right.
Then what we are asking, is there any trauma? Means two trauma I am telling. One is mental trauma and physical trauma.
Physical trauma.
During pregnancy also, that separation thought process or the separation activities is going on, legal or whatever it is. Yes. This separation, it influences the child very badly. Though they are not yet orphan, but mentally the child become orphan.
Yes.
They are not getting the full support from the parents, either from mother, either from the son. That is one thing. And another way I am telling, that what our observation from the research, the most of the ADD, what does it mean? Attention deficit. That means parents are not giving the proper attention. And most of the parents, those who are engaged both in office,
yes, both working parents.
Both are. Basically, the child has parents, but basically they are orphan.
Yeah.
And most of them shows their tantrums, irritability, spitting habit. It comes that spitting, actually they are spitting towards their parent.
Right.
And what we are giving, what we are doing, we are taking some bribes, chocolate, phone, this and that, try to bribe the child. But child's mind, it is craving, it is getting, asking something more. That we are not giving. And automatically they are becoming the ADHD. So many causes are there, but at least we should give proper attention to our children.
Yeah, we should make them feel secure and
feel secured. And I think most evil part of the mobile is that father is engaged with mobile, mother is engaged with mobile, and child is really become orphan.
Yeah, this is so true, and I'm very sure a lot of people will be able to relate this part of your speech.
Because stop mobile, if you really willing to improve your child's mental aspect, give proper time, passionately. Otherwise, children, it is very difficult. Whatever medicine you are giving, basically they are crazy to get love from the parents.
Right, very true. Yes, very true and very basic thing.
Very basic thing, but we are not utilizing this thought process.
True. Yeah. I hope you are enjoying this conversation with Dr. Sarkar. Now, we are going to stop here for today's episode, and we are going to continue this very interesting conversation in the next episode of VICHARDHAN. Thank you.
Like, share and subscribe to our YouTube channel. And do not forget to press bell icon.